So good morning, everyone. My name is Fatemeh Aman. I'm a non-resident senior fellow at the Atlantic Council South Asia Center here in Washington. Well, not exactly in Washington, at my home in Maryland. I thank you very much for joining us today. We are doing this via Skype. We were originally planning to do Zoom application. Unfortunately, our guests in Iran would not have been able to use it, to join us because of sanctions. So just be patient with potential technical difficulty that we may face. I have to thank Dr. Irfan Nuruddin, our director of the South Asia Center, and for putting this event in such a short time. And also would like to thank Barbara Slaving, director of Iran Initiative, for her continued support. We will be discussing COVID-19 outbreak in Iran, in Afghanistan, and in Iran's other South Asian neighbors. As all of you have been following the news these days, Iran has been hit hard by the COVID-19. Many factors have contributed to the scale of this outbreak: mismanagement, lack of proper information, as we will hear from our guests in Iran. Also sanctions, officials, health officials and the government contradicting each other and creating confusion for people. Also the challenges that the government is facing in, social distancing, quarantines that our guests in Iran will explain. All of these have contributed to have led to the scale of the outbreak that we are witnessing today. We have a great panel today, by the way. Let me just formally introduce my guests. From Iran, from Isfahan, we have Dr. Fatemeh Rezaei. She's a public health expert and a representative in CHD Group, which is a prominent public health organization that works with the governments, with the United Nations agencies, and with the corporation. From Afghanistan, we have Dr. Syed Khalid Rashid. He is a cardiac surgeon and a public health expert. He is a member of the Special Committee of Afghanistan Medical Council, and he is president of Afghanistan Islamic Medical Association. And very interestingly, he is the chief executive officer of National Alliance to fight COVID-19 in Afghanistan. Finally, we also have Dr. Kamiar Alaei, my old friend, a good friend, who is a prominent public health expert. He is also the co-chairman of the Institute for International Health and Education here in Albany, New York. I would like to mention that Kamiar and his brother Arash, who is also a physician, they were behind the triangular clinics in Iran in 90s and in 2000s, where they really changed the way drug addicts, HIV infected, and AIDS patients were treated in Iran. So I'm very happy to have all of you here. Thank you so much for joining us. Let me start with Dr. Rezaei. Dr. Rezaei, tell us what's going on and about the scale of COVID-19 outbreak.
First of all, say hello to all of you. And I want to say that in Iran, the most problem that we face with was challenges about economic sanction and economic recession that we come from, and the authorities and health authorities must to tackle with these programs. Although a lot of helps, international shipment of supplies come from different countries like China, Qatar, and other UNICEF, World Health organizations, but also beside them, a lot of non-governmental organizations and volunteers start to produce some PPE or personal protective equipment for health workers. But We are not sure about the standards of their products, and that was the challenge that we faced with at the first session. And I believe that sanctions directly and indirectly affect our ability to respond to this pandemic. And also, beside them, another problem that health authorities faced with was quarantine procedure. In Iran, we cannot obey the rules as China's and instruction as China's and Russia to direct people for quarantine. So the government used a step-by-step approach to tackle these problems. They first of all decide to reduce business hours and then give leave of absence to all their workers, and then they after work all of the workers from the works, and after that we return to the work little by little. As you know, and the president announced last night that at least 1/3 of workers, governmental workers, have to return to work since Saturday. So because of economic restrictions, we cannot stop all of the all business. Even if we cancel all the work and reduce and then close all the governmental office, you know that private sector cannot wait for this. They will start working. They can. So the quarantine cannot be successful as other countries. That's the things that I want to say for this session.
Okay, we will come back to that, with more questions, obviously. Let me talk to Dr. Rashid. Dr. Rashid, my condolences to you for the loss of your colleague, Dr. Hanif Ullah, to coronavirus. I noted that he was also a member of the alliance, National Alliance to fight COVID-19 in Afghanistan. So give us a picture of what's going on in Afghanistan.
Yeah, first of all, let me thank you all for this forum, and thanks to Atlantic Council for managing this discussion. The situation of COVID-19 in Afghanistan is also unfortunately not good. Today we had about 65 positive cases, and now we see that the epic curve is going on in Afghanistan and just started taking off and will go toward its peak. And we are expecting, unfortunately, the coming 2 weeks that it will be very bad for Afghan people because of there are different factors that I will explain later on, which if we could not manage properly, there will be a disaster. The last updates of Afghanistan is that we have total 423 positive cases. Today we had 65 cases. We have total deaths 14. The three deaths were added today, and fortunately we have 18 recovered cases. In this scenario, we see that the recovery is about 4.2%. There are a lot of factors that we are worried about, and we expect a disaster in coming weeks. The first thing is that we don't have well-equipped infrastructures. Fortunately, we see that the government has made 2 hospitals for COVID-19, especially for COVID-19 in Herat, and also started in Nimroz. But from other point of view, if we see it from human resource point of view, Afghanistan is one of the countries which is lacking intensivists. We don't have enough intensivists. And I will say, unfortunately, Dr. Hanif, which was the first victim of medical community, he was one of the trainer who was supposed to have a training session yesterday and for ICU care and for the case management. So we are lacking human resource. There are also we have problems in our test kits and also the testing. The low testing capacity, it is another problem. Though the government says I hope it is like that they are increasing in just one week. They have increased the capacity from 50 to 1,000 per day cases, tests per day. But unfortunately, it is still not enough. And we have another risk factor, especially for medical staff and the people who are fighting in the first line. There is the improper, not enough PPE, personal protection equipments, in governmental hospitals and also in private sectors. There is no active surveillance. If we see, unfortunately, it is another problem. We are just calling for surveillance, and they are coming and they are getting samples, and this is another problem. A very big problem that we are facing is the structure of the community. We have a traditional community where misinterpretation or extreme interpretation of religion is there, and therefore they are just saying that they have made obstacles in social distancing, which is the primary and the most important preventive measure. So these are the situation in Afghanistan, and we are seeing that different factors, social, technical factors, they are combining and making a very huge, contributing to a huge problem. So we hope that by mobilizing our community, mobilizing our different classes of community, we could fight COVID-19, inshallah.
Inshallah. But, before I switch to Kamiar, so you're saying that a low number doesn't mean that they are, just a low number of infected people. It's just because the test kits and the right tools are missing at this point, right?
Yeah. Actually, the improper sampling and also the low capacity of testing, these are the main problem. And also the social stigma. People who have already developed symptoms, they are reluctant to go to the centers, or they go there and they give sample. They are reluctant for this. These are the main problems.
Okay. To you, Dr. Alaei, what do you think of if you consider it a regional issue?
Sure. So hello, everyone. I'm so honored and delighted to be here. Thanks to Atlantic Council, and special thanks to my dear friend Fatima to give me this great opportunity. As you know, the trend of coronavirus is increasing, in the Middle East and South Asia, mainly started in Iran. Due to close partnership with China, there were a lot of direct flights came from China to Iran, and that was the entry point of coronavirus. And for several weeks, so it was minded by stakeholders, and that was the issue that Iran was one of the most affected countries by coronavirus, and that was the similar approach for border countries initially. And later on, you see some countries that they were more proactive. They tried to find a greater number of infected cases. Just give you an example, the border countries like Oman, like Kuwait, like UAE, that they have very small population. In Kuwait, they have more than 600 detected cases. In Oman is more than 300, and in UAE is more than 2,000 infected cases. And there were more than 12 countries that the first detected cases came from Iran. And over 20 countries, among the first few cases, they were from Iran. So that was the main source of entering. Instead of China came from Iran to those countries. But still today we have some other countries with a greater population that, given they don't have a very proactive approach, they don't have a lot of reported cases. Like Iraq, they have less than 1,000 cases, or Saudi Arabia, they have like 2,500 cases, or Afghanistan, as our dear colleague mentioned, or similar in Pakistan, there's only 4,000 cases. But at the same time, there are other countries that they have a greater population, but they were very, proactive, like India, that, a significant population, they have even limited access to sanitation. They were able to manage it because from the early days, they canceled their flights from China, and anybody who had history of visiting China, they were in quarantine for 3 weeks. I was in India during that time, and I saw there were some people, they were in car from the Ministry of Health, watching those houses from outside to make sure if they need anything to provide those, anything, food, medication, and so on. And this is the case that out of 1.3 billion population, they have only 4,500 cases. So that shows that even, the infrastructure of health is important, but it's not the key contributing factors to show the outcome of the coronavirus. Because, for example, Iran has a very good health infrastructure, but they have like now over 65,000 official cases, and based on estimation, there is more than 200,000 infected cases, while other countries that they don't have a great infrastructure, but they were able to control the situation. So, and this is, we can look at other countries beyond just South Asia. For example, in Europe, as you know, Italy was one of the countries that they didn't take it seriously initially, and that's why they got affected. The first country which was significantly affected was Italy, followed by Spain and France. And also, as you know, in the UK, initially they didn't take it seriously, and there were some debates that they said, let's get people infected, maybe got up to 80% of population, but later on they realized it's not the right thing. And you see a lot of people are infected, and even today we know the prime minister got infected, unfortunately. And similarly in the US, that has very well economy. If you see the policy, initially for first 6 weeks was to undermine coronavirus compared to even influenza. And that was the situation today. We see that the United States is one of the most affected countries by coronavirus. So this is the lesson we learned from coronavirus, that more than the healthcare system is the attitude of the stakeholders and policymakers how to deal with the coronavirus outbreak.
So, and I also need to add, as Dr. Rashid mentioned, and Dr. Rezaei also will talk about that more. A country as advanced as, say, any European country, with very solid public health system could also be hit hard by the virus, since we are also talking about test kits, which are missing both in Iran, in Afghanistan, in India, in Pakistan. So I mean, just a low number is not an indication that all measures have been working properly. So it's also an indication that there are not enough tools for diagnosis, right? Yeah. Okay, let me switch to Dr. Rezaei. Dr. Rezaei, as you also mentioned, now the Nowruz break ended, and the pictures that we see on social media and on in the news, with traffic jam and people, cars on the road, and with metros and public transportation so jammed. What is going on? Is it just is that an indication that social distancing and lockdown has not been really in place at all?
As a matter of fact, and as I told you before, we cannot be successful for quarantine completely like China in Iran, because people, the economic recession get in trouble. People, especially the private sector, cannot wait for supplies and the supplies that government promised to give them, because these supplies, for example, just can afford them for 1 week, just can provide this, their life for 1 week. So they should work. They cannot wait for the government to give them money, give them salary, and something like this. And besides, it's very important to say that these challenges refer to the preparedness phase of the disaster cycle. We are now at the response phase. The government have to prepare people and community for the epidemic before happening this epidemic. And we have a lot of capabilities. For example, we have a lot of community-based organizations and faith-based organizations. But before the epidemic, the government didn't involve them. And now we cannot use their capabilities because they are the first step and first line of vulnerable peoples and first contact with vulnerable peoples. And they can persuade in communities, and communities will trust them more than government. So before these pandemics and pandemic about shigellosis, diarrhea infection disease happened in Iran, and I told them that we should use a community-based approach to be successful with this economic recession and economic pause, and also the coincidence of Happy New Year's of Nowruz New Year Eve, excuse me, with the period of these pandemics also caused small business collapse in a bad way. The tourist cities were collapsed. Also, their jobs, their seasonal jobs and temporary jobs, affected by the economic, affected by this pandemic, and these all these because of, and the other problem beside this is lack of advance notification at the outset of the COVID-19 pandemic, because as Dr. Kamiar said, we don't have a very precise surveillance system and patient tracking system, and these are all depend to be prepared before the epidemic phase. But at the response phase, we have some advantages that, if you let me, I will tell you in the next session.
Sure, yes, I really need to know that, because the picture that you are describing to us is that, you know, because of the economic situation in Iran and the fear that the economy would collapse, as Mr. Namaki mentioned today, that they are not going to keep that social distancing and quarantine that you just mentioned. So, but I would really like to know how the community-based engagement could help, and could, if you could just explain in more detail.
Yes.
Dr. Rashid, yes, the question, my first question you answered, you know, about the low number, but I would like to know, as part of your national alliance to fight COVID-19, you suggest, your organization suggests that, you know, more aggressive quarantine and social distancing and quarantine of major cities, of some provinces in Afghanistan, and you beautifully suggest that if quarantine are in place and poor families, low-income families, don't have any support, any financial support, it won't work, because they need to obviously win bread for the families. So can you explain how would that be possible within today's Afghanistan with all other challenges that the country is facing?
Yeah, yeah, we have two kind of factors. If we see one determinants that are not in our hands, that are not in our control, just like I can mention that Afghanistan is mostly import dependent country, and we cannot close our borders with our neighbors. The second factor or determinant is that Afghanistan has a high number of migrants, Afghan migrants in our neighbor countries, especially in Iran. And we are facing the influx of migrants from refugees from Iran in these days. Unfortunately, in these days, they're coming back to Afghanistan. So we cannot lock our borders. The third is that still there is not the enough trust of people on our own health system. Either it is a private sector or governmental sector. Therefore, the patients, they are going to neighbor countries. A very huge, a big number of patients, they are going to Pakistan. You may be informed that today and yesterday the Turkham border was opened just for the people who were locked in Pakistan, and they were going there for medical treatment. So these factors that are not in our control. And from the other hand, there are several factors that we can bring changes in that. Internal factors. The first thing is that there is low coordination between Ministry of Public Health and the security forces for applying the rules of quarantine and lockdown. The second is that the people, the population, they're not taking the problem seriously. And the third is that the community structure and traditions and misinterpretation of religious law. And the fourth, the very important factor is the poverty. You know that a big number of high percentage of Afghan people, they are living under the poverty line. So the people, they're repeating and they're saying a slogan. They says that either die from hunger or die from COVID-19. So therefore, they are reluctant to the quarantine, and its effect, if they are going to their homes, so we will see another disaster from hunger, another disaster from poverty. So our alliance, National Alliance to Fight COVID-19, it is a civil society forum where 9 different organizations, medical specialty organization associations, medical associations, charity-based organization, faith-based organization, they all took part in this alliance. And this was for the purpose that we can address different factors contributing to the main problem. We have Jamiat Islah Afghanistan, which is a very big faith-based organization in a civil society, a very big network. We have in our alliance Afghanistan Islamic Medical Association, which is a very prominent medical forum. And also we have Afghanistan Family Medicine Association, AFMA. We have Afghanistan Gynecologist and Obstetricians Association. And also we have Ihsas Welfare Foundation, which are working for the poor people. So we have Majmai Ilmi Ulama, Islamic scholars, because I mentioned that there is a one big factor, that misinterpretation of religious rules, and people are not applying social distancing. So we have all these civil societies in one umbrella organization, NAF COVID-19, National Alliance to Fight COVID-19. And Alhamdulillah, we have achievements. For ulama and for masajid imams, we have prepared khutbahs. And our doctors, even myself, I went to the very big mosque in Kabul city, Abdul Rahman, and I delivered the khutbah. And I told to the people that it is the first concept of quarantine was narrated from our Prophet Muhammad sallallahu alaihi wasallam, and these like things. And also we have published books, fiqh ta'amul about corona, and how to deal with corona, the fiqh and the understanding of how to deal with corona from Islamic point of view, from medical point of view. And we have also prepared brochures, IEC materials, and we distributed to Najm, Nihat Jawanan Musalman. It's a youth forum in 34 provinces of Afghanistan. So Alhamdulillah, we have achievements, and we have a close coordination with Ministry of Public Health, with Medical Council of Afghanistan, with the Ministry of Hajj, with Ministry of Social Work, and these things. So we think that if we mobilize all the resources in all the classes of community, we will go toward an effective way to fight COVID-19.
That's wonderful, and especially because there is harmony, the cooperation between the government. You have the support of the government and all these NGOs and religious organizations. Maybe that's what I found very impressive. So, Kamiar, how about you? Can you, considering the Iran and neighborhood? I mean, you mentioned Iran's Arab neighbors, and but say something about Iran and South Asian neighbors. Could they eventually, as Dr. Rashid just mentioned, tens of thousands of immigrants going and coming from Afghanistan into Iran and the other way around. So can they avoid, or how can they avoid an outbreak such as Iran's?
So that's a great question. So there is two questions, First, what they supposed to do was initially to close the borders, not to let the infection get into the country. But now that the virus is already in those countries, just closing the borders is not enough or not necessary anymore. Because as you know, the outbreak started in China just from one person. So now each of these countries, they have hundreds, if not thousands of infected cases, which is enough to spread the disease. But when we say about the borders, that's an opportunity for new entries to have early detection, which means rather than just now closing the borders, to have more proactive approach in the borders for new entries, that the likelihood that a greater proportion of them are infected to be earlier diagnostic. And by this way, protect the rest of the population is very important, because it's very easy to find them in the border, but when they enter to the country, they will go to all the provinces that half of the provinces are hard in reach in Afghanistan. So I think they should have more mobilizing the resources to focus more in the borders, to have early detection. And the second one is to engage a lot of community-based organizations. I know some of them that Dr. Rashid mentioned, but they have to engage all of them and also ask for international aid, because based on international law, developed countries, they have mandate. If developing countries officially request for international aid, which includes technical support or financial support, this is the mandate of developed countries to do that. I think now is time for Afghanistan to ask for international aid, particularly for testing, because this is very important. The more you test, the more you can find infected cases and you can protect them and backtrack. If anybody has infection over the past 2 weeks, who was exposed, and that's the only way they can approach. Because I think if they don't do it very seriously and immediately, there will be lesson that they can learn from Iran. Iran had a great infrastructure, but they didn't take it seriously, and this is the situation today. How do you expect it should be better in Afghanistan or in Iraq? So I don't think so. Maybe they don't find the cases now, but later on they will get more cases because it's exponential. And
Yes,
based on
yes.
the lesson we learned from China, the only way you can control is that you do faster than the virus, and that's the only way. So I'm very concerned for the future of border countries. Lesson learned from Turkey, until a few weeks ago they said they have no single case, which was not the case, and now you see they have more than 27,000, and they would be more. But so it shows that if you don't make a very serious, measurements, sooner or later you get affected. And given you have very poor, as you said, economy, you get greater, number of population, that they died, they lost their jobs, and so on.
Sure. Yes, that is what all three of you emphasize. The having enough test kits and the tools for diagnosis and to put in place social distancing and quarantine. Dr. Rezaei, you just briefly mentioned that as well. How did misinformation and lack of being prepared by the authorities, health authorities and the government authorities in responding, in answering questions, how did that play a role, in the current situation, in the scale of the outbreak?
Yes. As you know, that there are a lot of claims that Iran statistics are fake. They do present actual cases, not suspected cases, or even confirmed cases that are quarantined themselves in their home. I know a lot of my co-workers who got COVID-19, but as their body recover for COVID-19. So these are not calculated for confirmed cases in the statistics. And that might be the reason that the official statistic is not trustable for some people. And also, we face with breakdown of mutual trust due to social medias because they prescribe a lot of medicines, a lot of fake medicines, and claim that other countries are using these medicines, alternative treatment, traditional treatment, and people confuse for the main source of information that they should get. At this time, a lot of link web and source of information was made by government, but I think that the notification and informing this source of information was not well, and not general people don't know, except, for example, some people like me that are in the health systems, general people don't follow them. They just follow fake news, and for example, as you know, we have more than 1,300 deaths due to alcohol consumption because the social media they prescribe that if you alcohol you will not get COVID-19, and so that's the reason that people don't follow the governmental news, the governmental recommendation, and the precaution that they advise the community to follow. They follow some social media, and I think they trust these media, and they present some contradictory information, as you know, even between some authorities. And I think that the other problem that you, as you asked me to explain more, that why there are a lot of contradictory information in Iran between authorities, is due to the reason that we don't have a main commander and a liaison officer. As you know, in disaster management, just one person have to communicate with the media and inform people. But all of the authorities gave a right to themselves to announce and present a statistic, present everything, give suggestion and non-technical suggestion about everything, and but due to scientific approach, we should have just a legend who speak about the COVID-19 statistic, speak about the precautions, speak about what should they do, and I hope that it could be an experience for next disasters this could help people that not be affected more in next disasters. It depends to our authorities to be more informed about to pay attention to social media and rumors that affect people.
Yeah. So as all of you, especially you, Dr. Rashid and Dr. Rezaei, emphasize, how important it is that the government and the official numbers are really correct, and there is no secret in it, and they feel the responsible authorities are very direct in their assessments with the people. And how about Dr. Rezaei? Is there any cooperation, something like what Dr. Rashid mentioned? Is there any cooperation between NGOs and the government? Does the government provide support to NGOs?
Yes, and for NGOs, just the military service have a right to cooperate and integrate their services with NGOs to just support medical health systems. But for example, the health system can use some medical services that military services provide for them, and community-based organization can cooperate and work with military service to join to response to this pandemic.
Mm-hmm. Mm-hmm. Okay, Dr. Rashid, would you add anything to about your experience that hopefully would be also used in Iran? How do you involve religious institutions and NGOs in the fight against COVID-19?
Yeah. Actually, I will conclude I will suggest that the COVID-19 issue should be considered as a top national issue. The top priority is to fight against this disaster. And the second thing is that the government and non-governmental organization, they should work together, because we cannot fight, even I say that even in developed countries, it's important to have the aid of community structures in the faith-based organizations. Faith-based and community-based organizations, they should be mobilized, because if we accept or not, it is a fact that they have a very deep effect in the communities, in the people, in their minds, in the way that they're changing the minds of the people. So actually we see that the important measure in fighting against COVID-19 is the preventive measure, social distancing. It has a very big value in this fight. So I think there is a major part that the faith-based organizations, religious societies, community-based organizations, and non-governmental organizations, they can play. So this is very important for the governments, how to mobilize these organizations, and how to have their trust, and how to coordinate with them. The last point, which is especially important for the countries like Afghanistan, where poverty and hunger is high level, there addressing the hunger and addressing the poverty, it's a very important factor in convincing people to stay at their homes. So therefore, I think government also should have a proper mechanism and system for addressing hunger and poverty. in NGOs, non-governmental organizations, they should also mobilize the community, the rich people. They should help their neighbors and other the experience which we have here. And Alhamdulillah, under the NAF COVID-19, we have helped thousands families who are in extreme need for help. We have, Alhamdulillah, helped them in terms of food packages, preparing food packages and all other needs. So I think the coordination and the help of all these organizations is very important.
Yeah. Maybe we should also mention that the National Development Fund of Iran is also going to, it was yesterday, right? 1 billion euros to, part of it will go to poor families and low-income families, help them, hold on to until this crisis is over. Dr. Alaei, Iran has in the past, done a great job fighting, other outbreaks such as CCHF, Crimean Congo hemorrhagic fever, especially in the Iran-Afghanistan region, and polio, some really commendable fight against these infectious diseases. Why the outbreak this time found such a broad scale, and why it didn't work this time?
That's a great question. I think there are a lot of contributing factors. The first and the most important one was they politicized non-political health concern. And that was the main, factor, that there are a lot of, doctors, experts, and stakeholders in Ministry of Health. They try to, make some, recommendation, but because that was not part of the national interest, they were not considered seriously. And if you look at today's debate, starting a couple of days ago, even some of the high officials from Ministry of Health, they said they were misinformed by the report came from China that they didn't take it seriously. And so that was the proxy that shows that they admitted that they didn't take it seriously. And also, a few days ago, they said that the first few cases, they thought it's influenza rather than coronavirus. But generally speaking, the outbreak started in Iran due to some occasions. That one of them was anniversary of the revolution of Iran, like mid-February, and after that there was a parliamentary election. So the concern of the government was that if they admit that they are facing the coronavirus outbreak, that may discourage people to participate. So that may be one of the contributing factors. And I think that was beyond the control of the government, because, in Iran is not very centralized government. So there are a lot of other, part of militia that they have influence. For example, just a couple of days after they found the first 2 cases of death cases in Qom, the Ministry of Health in the National Security Council recommended to put Qom, the religious city, which was the original place that the first 2 cases were detected, in quarantine. But the head of the Office of Intelligence Service of Revolutionary Guard disagreed. And that was a kind of controversy that the next day, even some people at Ministry of Health, that they said they have to do some kind of progressive measurements, they changed their statements. And even they said, we don't follow the quarantine, it's outdated back in World War II. And the spokesperson, the next day, he got infected by coronavirus. So it shows there was a discrepancy among stakeholders. And that was unfortunate that Iran couldn't use the maximum benefit of the great infrastructure that they have, the great doctors, experts, policymakers. And as you mentioned, Why there are a lot of other external factors that they may impact on to what extent the government is able to control the disease. But just few months before this outbreak, we had outbreak of influenza. So they were able to manage it very well, and other diseases, as you mentioned. So it means the external factor was the same, over the past few months or years. But this is the attitude of stakeholders that still today is not clear. And I think this will be very challenging, for Iran.
Yes. Thank you. We only have a few minutes left. I would, this question is to all of you. To Dr. Rashid, I'm going to change the content. Dr. Rezaei, what is the impact of sanctions? How did that create, how did that help the outbreak to be the way it is, or what would have happened without sanction, or if the sanctions would not be imposed on medical sector at all?
Sanctions, first of all, affected people, Iranian people, because, and that's the reason they cannot wait to see the end of the epidemic. So they want to go work and earn money because the life is not affordable for them. Even if the government provide all the goods and products that they need, but then the price of them rise. So they cannot afford, even by the helping of the government, supporting package that the government is going to give to some poor family. But that's the reason that it directly affect or indirectly affect the social distancing failure. They cannot do that. I myself know that I have to go out. I have to go work, for example, especially for private sector. And also there are some medicines that they are available, but the price of them is not affordable for all of the families and all of the people. Just rich people can access to some medicines, and that's the reason that the government and the health systems get in trouble and should tackle with these challenges. Yes, that's it.
Yeah, thank you. Dr. Alaei, do you want to add anything to impact of sanctions?
Yes, definitely. So it's very important, when we talk about sanction, why the U.S. government mentioned, over the past months that they try to remove those sanctions, particularly for food, agriculture, and medical supplies, which means those supplies are more available, but they are not accessible. So it's very important to distinguish between availability and accessibility. Just give you an example. For example, maybe the treatment for coronavirus was not available in pharmacies, but now they are available. But if you don't have health insurance and you can't afford, they are not accessible. And it's very important that there are a lot of pharmaceutical companies or others that they're in charge of medical supplies. They hesitate to sell those drugs or tests to any organizations. For example, there are some US-based organizations that they have OFAC license, which means they have approval from the Treasury Department. But when they approach some of those pharmaceutical companies, they don't want to provide a test or medication if this is going to people of Iran. I think it's very important that I think it's very important for the US to have more proactive approach, and even European Union or UK or Canada, because who is the most affected are the people inside Iran, especially disadvantaged population. And it's very important message that the Western countries that they share, that they care about people inside Iran by being more proactive and try to provide those supplies, medical supplies and medication and tests. because each single test can protect a lot of people, because as you know, a person who have coronavirus may infect several other people. And I think this is the time for global health diplomacy and dialogue between doctors, experts, and citizen to citizen diplomacy. And I think there should be no excuse, to provide those things for Iran, because people of Iran, especially as you know, we have a young population, they make the future of Iran, and they will never forget today. If there are hundreds or thousands of people die due to lack of access for those tests or medication, so there will be no excuse. There is no question that the government, they did mismanagement, no question, but we shouldn't make that as an excuse not to support people inside Iran.
Excellent. Thank you, Dr. Alaei. And Dr. Rashid, how is the sanctions on Iran impacting Afghanistan, considering the fact that tens of thousands of Afghans live in Iran, go to Afghanistan and back to Iran? How are they affected by these sanctions?
Yeah, definitely. Just if we see that we have a lot number of immigrants there in Iran, refugees, and whenever there are sanctions in Iran, definitely we see that there are the lack of medical supplies and there are lack of consumables and other things. So they are affected there. And from the other hand, the Iranian government, they are pushing all the immigrants and at this critical time to go back to their country. And so there is a very huge influx of the refugees to Afghanistan. And unfortunately, we cannot manage all, and we cannot quarantine all these refugees who are coming back to Afghanistan from Herat and from Nimroz. We cannot collect them or quarantine them in one province. So they are disseminating in all country, and they are going to very distant provinces. So it is a very huge problem for Afghanistan. From the other hand, we see that we are also dependent on imports. We need to have imports from Iran. If there are sanctions on Iran, so we are affected, and Afghanistan is affected from each point, even from food, from food items, from different things that we have a very low capacity of internal production. In PPE, in medical consumables, sanitizers, and detergents, food items, medications, all these things. We are dependent on our neighbors. So definitely it's clear that sanctions on Iran will directly affect Afghanistan in the context of COVID-19.
So yeah, exactly. That was the last word that you said. I was going to repeat that Afghanistan is also impacted by sanctions on Iran, and during this time of this crisis of COVID-19 outbreak, it is also an additional hardship on Afghanistan. Thank you. Yeah, please go ahead. Go ahead, Dr. Rashid.
Yeah, I was just saying that unfortunately we are expecting a very bad scenario if the cases are going, the number is going increasingly high. In the case management, we don't have proper infrastructures, we don't have proper human resources, we don't have even ventilators. We have 12 ventilators in a dedicated center for COVID-19 cases in Afghan Japan Hospital, which is located in Kabul. We have just only 12 ventilators. And even if we find ventilators, we are lacking the oxygen supply. And this, as I mentioned before, that we have a very low capacity of internal production in terms of pharmaceutical things and medications. So this is another disaster. So we are just seeing the scenario very bad in the coming days. Therefore, I think the main thing that we can rely on is to mobilize social organizations, NGOs, and other classes of the community to work on the preventive measures. Because if it goes to the case management, we will see a disaster in this country. God forbid.
Excellent. Thank you so much. Dr. Rezaei, do you want to add anything? Because we are almost at the end of the this panel. Do you want to add anything?
I want to add something that about risk perception or risk understanding of the people. That is the global approach that the United Nations advise all governments to pursue this for their community. And in Iran, another problem is that the risk perception or risk understanding of the people is not enough. And that's the reason that you can, in this epidemic, when the Health Ministry of Health instruct to limit and restrict the religious and mass gatherings and the entrance of saint places. Some people protest and complain about this government order, and that's the reason that we should from now prepare people and improve their risk understanding due to global advices.
Beautiful. All right. Thank you all very much. It was really a wonderful, very informative session. Thank you, Dr. Rashid from Afghanistan, Dr. Rezaei from Isfahan, and Dr. Alaei from, are you in Albany, New York?
Yes.
Yes. You're here right now. All right. Thank you so much. Thank you for joining us at this South Asia, Atlantic Council South Asia event.
Thank you very much.
Thank you for your effort.
Thank you very much. Thank you.